It's so exciting to see so many people who've been engaged and involved in the planning process up to this point. But if you haven't, the blueprint is now online, but I'm going to take a couple of minutes to walk through some of the essential elements of it. Sure. There we go. So the strategic planning leadership group started their process by building a strong understanding of who are the people who are experiencing homelessness, what are their needs, what do they look like, and how do we respond as a community? We started this by looking at some of the data. On any given night, about 700 individuals experience a housing crisis. But over the course of a year, it's about 4,000 people. I had the opportunity through this planning process to actually go to shelters, drop-in centers, to do some ride-alongs with our outreach workers, and I talked to people experiencing homelessness. I talked to one young mom who recently had twins and was looking for some financial assistance and some help finding a new place for her new family. I talked to a veteran with post-traumatic stress disorder, some addiction issues. He wanted to work, but just needed some help with his treatment and a new place to live so that he could rebuild his life. And I talked to a convenience store clerk. And this was a woman who was sleeping in her car. She had a job. She just needed a little bit of help to find a place to live and maybe a little bit of financial assistance to get started in that new place. So the picture of homelessness among those 700 people on any given night and those 4,000 people over the course of a year, it looks very different. The experience of homelessness is unique to each individual. So we needed a blueprint that would respond individually and had the flexibility to provide solutions that could be fit to each individual's particular needs. The blueprint is organized too fast. There. Slight delay, so it's taking me a second to catch up. It's organized around specific goals. We wanted to understand how to create a system that prevented homelessness whenever we could. We could intervene soon enough so people didn't have to become homeless in order to get the help and support that they needed. For people, when we weren't able to prevent it, we wanted to accelerate their exit out of a housing crisis, create more housing options and move them into those options as quickly as possible. And the third blueprint goal was just to strengthen our safety net and our community's ability to respond with all of the resources and supports. The strategic plan's leadership group decided that we were going to look at evidence-based solutions. There were lots of examples from data and from actual outcomes in other communities where we didn't have to reinvent the wheel. We could simply just scale and create solutions that were specific to our community, but were working in others. We also wanted to focus on strategies that we knew would have results, that these were proven to move the needle on homelessness, to have an impact in other communities. So those were sort of drivers for what was included in the plan. The plan is organized around 7 focus areas. The first, reducing inflow. This is essentially preventing homelessness. And if we target prevention assistance to people right at the point at which they're experiencing a crisis, but before they become literally homeless, we can often prevent a shelter stay. So identifying who those people are in a crisis is really critical. The second piece, improve our crisis response. The crisis response is essentially our shelter safety net. And we need to expand shelter options for singles, for families, and for youth. The third focus area is ending unsheltered homelessness. We had lots of conversation both throughout the community and in our leadership group about the intense focus that this community wanted to place on ensuring that our downtown and our livable areas and our public spaces were spaces that everyone felt that they were welcome and able to stay if they needed to stay, but that no one had to be unsheltered or on the streets if they chose not to be. We would accomplish this through coordinating outreach efforts, linking together different outreach teams, including more clinical expertise in our outreach, and instituting a new response called rapid exit. And this takes people directly from the streets and puts them in housing with the kinds of supports that they need to maintain that housing. The fourth focus area is accelerating exits out of homelessness. We know that the solution to homelessness is housing. We simply need more housing options. So proven program models like rapid rehousing, where we provide supports to help people find a landlord in the private market, and then financial assistance to get them set up in that housing and some rental subsidies to maintain that housing for a relatively short period of time. Some people would also need permanent supportive housing. These are people with long-term needs, often a disability that requires intensive services that's matched with the housing. These additional expansion of rapid rehousing and PSH are key to accelerating exits out of homelessness. The fifth focus area is strengthening connections to adjacent systems. The homelessness system can't and shouldn't be responsible for ending homelessness purely on its own. It's going to take the concerted efforts of other systems in addition to the homelessness system. So our criminal justice system, hospitals, behavioral health, education, all of these other systems have a role to play in helping to identify people who are experiencing a housing crisis, and then linking and making sure that those people get the kinds of services and supports that they need. The sixth focus area is active system management. Again, the leadership team was very focused on data and using data to inform decisions. So active system management is simply using information about our system. How many people are homeless? When do they experience homelessness? How long do they stay? What services and interventions do they need? And then using that data to actively manage the system. Where do we need to expand options? Where do we need to streamline efforts? And when we're not getting the results that we're expecting through the concerted efforts and the interventions, what kind of adjustments do we need to make to our system? So this active system management is a strong component of the plan. And then finally, the seventh focus area is developing more affordable housing options, like vouchers, speeding the development process for more housing, of housing that gets developed, ensuring that some or a portion of the units or the components of that housing are accessible to people who are trying to exit homelessness. To ensure that these seven focus areas actually get some momentum when we move the needle on homelessness, the plan and the leadership group spent a lot of time talking about how do we activate or ensure the implementation is actually moving forward. First is with oversight, with transparent visibility into who's making decisions and what policy guidance is informing their decisions. We can ensure that there's a buy-in and support for the direction that the system is going. Homeward, which has been our backbone organization for the homelessness system, is going to be paired with a reconfigured homeless coordinating council, and we'll hear more about that in just a moment. Each of the focus areas in the plan has a designated manager. The manager's role is simply to shepherd or organize all of the different people involved and the organizations involved in supporting strategies and ensuring that everyone's on the same page about what resources they need, what issues or challenges they might be encountering, and how do they elevate or bring some of those issues and challenges to the knowledge of the HCC and Homeward to help the solution-oriented implementers. Each improvement strategy that's included in the plan has a designated lead. This is an agency or an entity who's responsible for moving that forward. Those implementation strategy leads will have a set of resources that are designated to actually implement the strategy. There's a set of supporting organizations. The acknowledgement is that they can't do it all alone, that they have to do it in coordination with other providers and agencies in the community. And also a set of timelines or milestones so that we can track what's expected to be accomplished over what period of time, and then using that as a way to kind of check in on the progress. In addition to that, the leadership team identified key performance indicators in the plan. And these relate to reductions in homelessness, reductions in the amount of time that people experience a housing crisis, increases in exits out of homelessness to successful housing, and reductions in the percentage of people who might come back to the homelessness system after they've already exited. So using these key performance indicators and progress in a positive way to measure whether or not we're having the success that we intended with the plan. Key to implementing the plan is activating a new set of organizing and authorizing entities. This reorganizing the oversight structure includes updating our homeless charter, which describes the roles of different organizations in the system, Homeward as the backbone organization, and a reconfigured HCC, or Homeless Coordinating Council. The Homeless Coordinating Council will have leadership from the public sector paired with the private sector, and that public-private partnership is really key to ensuring that we're using the data to inform decision-making and making decisions in a visible and transparent way. And we'll also be prioritizing clear next steps so that there's a roadmap for what will happen in the near term, what happens over the course of the next year, and then in the subsequent second, third, fourth years of the plan implementation. We've ensured that not just a set of strategies and activities to move this forward, but an implementing structure to harness the energy and the momentum of the community to make sure that there's progress in a positive direction through this plan.